there's no reason to do the bell spine. So if the patient has pain, they bend down, they touch their toes, they say, yeah, I kind of feel that. You ask them where, somewhere in the low back. All right, let's see if we can lock down the SI joint now and only have the low back move. If I lock down the SI joint, the patient bends forward, they'll probably only be able to go about this far. If the pain's still there, what's it coming from? The lumbar spine, because that's the only other part that's moving if you're doing this right. If the pain goes away, SI joint. So this is a pretty good test. Hasn't been vetted that well. I mean, we think, oh, it's so simple if you do it right, it's an awesome test. But we don't know statistically if this is a great test or not. But it does give us some information. So let's have Michelle come up, and let's say bending forward, touching your toes, you had a little bit of low back pain. So now I need to lock down the SI joint. And what I want you to do is focus on getting your hip, or if you're shorter or the patient's taller, your side, against the sacrum. So I'm in like this. So I'm going to talk to the patient first and tell them what I'm doing. So what I need to do is, when you bend forward and touch your toes, you have pain. So now I'm going to put my hip against your sacrum back here, and I'm going to lock that down, make sure that doesn't move. And we're going to see if you still have pain when you bend your low back. Okay? I'm going to put my hip there, and I'm also going to hold on to the front of your hip. So I'd ask them if they were ticklish again, and if they were, I could put their hands there. If not, it's not a big deal. So I put my hip against the sacrum like this. I hold on to the SI joints, and then really slowly bend forward. And as she does that, I'm going to lean back. See how far she goes? Keep going. Keep going if you can. Keep going. I'm not letting her. If she goes, go ahead and bend down to your toes. That means I didn't lock down the sacrum. And notice what happened? Go ahead and do that again. She pushed me back. Because her sacrum literally is pushing against it. So if they can bend down and touch their toes, you're not locking the sacrum enough. Because there's no way. When I flex my low back and it's all the way flexed, for me to flex the rest of the way, my sacrum has to rock forward. And my SI joints actually will move a little bit even. So we lock that down. That's about as far as they can go. There'll be a little bit of a range depending on how flexible their lumbar spine is, but they shouldn't be able to flex all the way down and touch your toes.